Hi, my name is Dr. Joe Childs, and on this DVD today we're going to talk about attention deficits, ADHD, and hyperactivity. Let me start off by saying that the vast majority of children that we've treated in our practice with these problems have either A, gotten off the medication if they were already taking medication, or B, have never needed to take the medication after they've come into our practice. Now the reason why that is because we've had incredible success using what we call brain-based hemispheric integration therapy. We can call it brain-based therapy for short. And that's basically what we're going to talk about on this DVD so you can understand what your treatment options are. Because it's not my job to have your child go on medication, have your child go off medication, take your child off medication. But what I have found is that the majority of parents that come into our office really don't want their kids on the medication. The reason why they have their child on the medication is because they think it's their only option. They think that it's the only thing that they can do is use medication. And the reason why most parents don't want their kids on the medication is, number one, they're worried about the side effects. I mean, the weight loss and the lack of sleeping and the fact that they're giving their child a stimulant just kind of scares a lot of parents. But again, most of them are not aware that there are some drug-free alternatives to the medication. Now, one of the big points that I want to make to all parents, or to anyone who's listening to this DVD, is we've got to be very careful about the labels that we place on a child. Because a child can either live up to the labels or they can live down to the labels. And again, a label, it doesn't really tell you that much. So in our office, we're not concerned about the labels. We're not as concerned about the diagnosis. If your child comes in with ADHD or ADD or Asperger's or whatever. Now, we are concerned about that, and we're going to look at that. But our treatment philosophy is to treat the whole child, not just treat the diagnosis. Okay? Because the reason why is because the majority of these children that get diagnosed, a lot of times they're misdiagnosed, and it really doesn't tell you what you need to do about it. Okay? The diagnosis of ADHD. So many kids are misdiagnosed, and so many people, for that matter, are misdiagnosed from anything from ADHD to migraines to even cancer. I'll give you an example. A child comes into our office and he's 10 years old. He's been dealing with ADHD for the last 5-6 years. He was 4 years old when he gets diagnosed. And, as you talk to the parents, we find out that the child has been taking various stimulant medications, the Ritalins, the Strateras, the Concertas, you name it. And at 10 years old, the child comes in and he's at least taking 1, sometimes 2 medications. And we've seen a lot of kids just like this. And the interesting thing is the child's been to probably 10 different doctors. The average person that comes into our office has tried, 5, 6, 7 different practitioners before they come into our office. And the interesting thing was the child was diagnosed with ADHD at 4 years old, but now at 10 still has the diagnosis of ADHD, still needing the medication. And the reason why is because basically what's happening is he's having his symptoms treated. They're not really looking for the true cause of the problem. And, they're just really masking the symptoms with the medication. So the child, when he's on the medication, does better, but when he's off the medication, still has ADHD. So when somebody comes in with the diagnosis of ADHD, it really doesn't tell us that much. We need to know more. We've got to dig more. We've got to look at your child functionally. We need to look at their neurology. We need to find out what parts of the brain are working well, what parts of the brain are not working well. Because there's certain parts of the brain that, when they're working well, make your child not distractible, make your child not impulsive, make your child able to focus more in school. And there's aspects of the brain that control that. And when they're not functioning well, when there's dysfunction in those areas, then your child has these types of problems, the ADHD and whatnot. So, in terms of my qualifications, I'm a doctor of chiropractic, but I also specialize in functional neurology. And basically what that means is that I treat the brain and central nervous system. Now, I don't treat the brain and central nervous system like a typical medical neurologist. A medical neurologist uses medications to treat the brain and nervous system. What we do as somebody that specializes in functional neurology is we treat the brain and central nervous system using drug-free stimulations. We'll talk about that as we go on. So I'm a specialist in functional neurology. I also am a specialist in functional nutrition. I've had a lot of nutritional training, and so most kids with ADHD need some nutritional approach when they come into the office. I'm also a certified interactive metronome practitioner. And the interactive metronome, we're going to go over that on this DVD, is a computer-based program for kids with attention deficit disorder. I'm an exercise physiologist, and we use a lot of exercise in our office. I'm also a certified doctor in spinal biomechanics, which basically means we work with the structure of the spine. So this is basically what we do. And we see a lot of kids in our office, and I believe, from as well as I know, we're the only practice in Chester County that actually combines all of these things under one roof. We want to leave no stone unturned in finding out why your child has the problem and developing a specific program, a drug-free program, in helping your child with ADHD. So that's basically what we do, because what really makes our office different is we look at these problems, the ADHD, as neurological issues. Now, most of what's out there, and most doctors look at these as simply behavioral issues or maybe even psychological issues. But that really doesn't do these issues justice. And the reason why is most of the research out there has shown that these problems come from areas in the brain that are not functioning as well as they need to function. The frontal lobes, very big area. The cerebellum, the brainstem, the thalamus, the basal ganglia. You have to look at all of these areas to be very thorough. So the reason why we've got such great success in our office with these conditions is because we look at everything. We look at your child's neurology. We look at your child's physiology. We look at your child or teenager, because we work with teenagers and children, infants. We work with all ages. But we're going to look at your child's, again, like I said, nutrition. We're going to look at their neurotransmitters. We're going to look at all these things to determine the reason why your child has the problem.